Liam's going to give us a chat on NHS agencies in Dorset, the Dorset picture. Over to you, Liam.
Hi, Nige. Hi, everybody. Yeah, if you don't know me, my name's Liam, and I've worked in the Dorset Resilience Network, I guess, or the local resilience forum for 13 years or so. I used to work with Nige and David Beavis and some of the people that you'll have linked in with this week when I worked with the county council. I moved across to the NHS 5 years ago, and I've been working for the clinical commissioning group. I'll explain what that is in a moment in a bit more detail, and some of the other parts of health. We'll be moving on soon after. Just before Easter, I'm going to work for the regional emergency planning team of NHS England and Improvement. So that's a good step to go into for me. But I shall miss being part of Dorset, and I'm pleased to see that community resilience is still featuring as heavily as it is. And great to get a network like this around it and grow that. Great to hear about template plans coming together. So I guess if I pitch this right, I'm going to be able to show you a bit about what really thought would be useful is showing you a bit about the NHS and its inner workings, and how we always find a way is the motto that I've kind of been drawn to over time, and I think that rings resilience straight away. So the NHS always finds a way. I hear it sometimes on the news. I hear it sometimes, lots of times, from senior managers. But the reality is that right now the Dorset NHS is under as great a pressure as it's ever been under since in its sort of 75-year history. And it's really worrying. We're not seeing so much of it in the news as we would usually in a January, February, March, because we're obviously within pandemic coming out of that, but we've got this awful conflict as well. But yeah, the national rate of discharge is extremely low. The waiting lists are very, very high, and we're hearing of cases in Dorset of people that have been waiting for elective procedures for over 2 years. And families are impacted by that. But however, still at that point where you pick up the phone for one of our urgent services across the southwest, amazingly, you can still get a pretty good service for the very most serious conditions that occur. So I am an emergency planner, but I'm based within the urgent and emergency care team, and at the commissioning group, and we don't do any operational delivery, but we make sure that the funds are put out to those organisations properly. So I'm not an expert in the pathway of urgent and emergency care or elective care in those respects, but I can see at the moment just how challenging things are. So I've got just a few slides, and I've got some video as well that I think really pitches well just how the NHS is working currently. So I'm just going to set my projection running, and I want to make sure that I do it with some sound so we can hear these videos coming in. And if at any point you can't hear some of the things I'm playing to you, it'd be really good if somebody just flags a hand or puts something in the chat, and I'll stop and arrange that. Okay, so it's a bit of a beast, the NHS, and I just want to make sure I'm not playing this too quickly. Bear with me a second. It's a huge organisation, and it's got so many different arms to it and everything. And I just think we have managed to embed a huge amount of resilience in the way that we're setting it up to work for the future. This video is produced by the King's Fund, who are one of the main commentators, I guess, on media outlets that specifically focus on health and social care. And they made this about 3 years ago, but it's a really excellent. So there are certain things I'm going to stop and just explain that are slightly changed in the story or in their terminology. But they ultimately, they tell very well just what we're involved with doing from end to end. So I'm going to play this. Hopefully the audio comes across clearly. Let me know if it doesn't, and I'll step in and out. Lasts about 5 minutes.
How does the NHS in England work? What organisations make it up, and how's it changing over time? Since the NHS is largely funded by our taxes, let's start with the government. They decide how much money the NHS receives and do top-level priority setting. The Secretary of State for Health is in charge of the Department of Health, which is actually quite slimmed down compared to what it used to be, and it passes most of its money on to a range of other organisations. The lion's share goes to an organisation called NHS England. It was created in 2013 as part of sweeping reforms aimed at improving services by increasing competition, cutting red tape, and keeping the government out of the day-to-day running of the NHS. But this is all actually quite far from what's really happening, as we'll see. NHS England is responsible for overseeing the commissioning, the planning and buying of NHS services. In practice, it also sets quite a lot of NHS strategy and behaves like an NHS headquarters. NHS England commissions some services itself, but passes most of its money onto 200 or so clinical commissioning groups across England, also known as CCGs, which identify local health needs and then plan and buy care for people in their area, people like you and me. CCGs buy services from organisations of different shapes and sizes, from NHS trusts that run hospitals and community services to GPs and others that provide NHS care, including organisations run by charities and the private sector. Jostling for position alongside NHS England is NHS Improvement. It oversees NHS trusts, and right now its focus is very much on managing the money.
I just want to explain NHS England and NHS Improvement have now merged at the moment. Okay, so I'll carry on the video.
So, for example, it tries to ensure that trusts keep a lid on costs, operate efficiently and, improve. Also in the mix is the Care Quality Commission, which inspects the quality of care provided. There are also a whole load of other bodies with their own remits and acronyms. This is quite a crowded landscape, and the upshot is that these different organisations can at times issue seemingly contradictory messages. There are also unclear boundaries about exactly which organisation is responsible for what, prompting questions about who's really in charge. But the NHS never stays the same for long, and the way these organisations work together is changing. The most recent changes started in 2014, when NHS England published a vision for the future of healthcare called the NHS 5-Year Forward View. This called for more of a focus on preventing people getting ill in the first place and giving patients more control of their own care. It also set out a range of so-called new models of care that aim to get services working together to provide joined-up care for patients. There's not been much progress on the prevention bit, but lots of energy has been put behind the new models. These set out to do things like provide care traditionally delivered in hospitals, like chemotherapy, in people's homes, and get people to work differently, for instance, dementia specialists carrying out clinics and GP surgeries. This new way of working is particularly designed to help meet the needs of increasing numbers of people who need support to help manage a range of long-term health conditions, particularly older people. 50 areas across England, known as Vanguard sites, have been trialling these different ways of delivering more joined-up care over the past couple of years. This is all part of a broader shift towards organisations working together more closely to meet patients' physical and mental health needs, and away from an NHS marketplace. The NHS has invented or adopted a whole array of acronyms to describe this new and evolving approach. Firstly, there are STPs, or Sustainability and Transformation Partnerships, which aren't things or organisations in themselves, but, as the name suggests, more a way of working together in partnership. These were created when NHS organisations were asked to come together with local authorities, charities and others to agree how to improve health and modernise services in their patch. There are 44 STPs in England, all focused on progressing the ideas set out in the 5-Year Forward View.
Okay, I've just paused it there. So the term STP is live at the moment. However, what we're going to do with that network of systems, these are the strategic partnership transformation areas, they are going to become integrated care systems, and that's going to happen on the 1st of July this year. Okay, so that is all under the same principles that have been described in this video of drawing services together even closer. It's an American model of the way that they run the health service in that country and those organisations operate. And again, it's very much about bringing adult social care and healthcare provision into the same wider system. I'll just carry on with this video. I hope you're finding it interesting and useful.
But they haven't exactly had an easy birth, with accusations of plans being cooked up behind closed doors and driven by financial cuts. Some STP areas are on track to develop into another 3-letter acronym, ACSs, or Accountable Care Systems. These take inspiration from parts of the US, where organisations work together under a set budget to improve health and coordinate services for people who live in a particular area. In part, these changes are all about managing the limited resources available to the NHS, but they're also about working together with services outside the NHS, like social care and public health, that have a really important impact on our health. This requires much closer working with local authorities. Some areas are taking this regional-based approach even further. So, for example, in Greater Manchester, devolution is giving local NHS and council leaders more control over how health and care services should work there. And across England, we're also starting to see CCGs merging, hospitals working together in chains, and GPs forming large groups of practices. So where does this leave us, and what next? Well, there's a lot of change going on, and it throws up loads of unanswered questions. Not least, what does this all mean for patients like you and me? Well, in some ways, nothing much changes. You'll still see a GP when you're ill, and there'll still be hospital care. But if these changes are successful, you may well get more support and treatment at home rather than having to go to hospital, more help to stay healthy, and you might also get to see a GP quicker. You might see more controversial changes too. For example, you may need to travel further from home to access better hospital services. All of these changes take time and won't be easy, especially when the NHS budget is failing to keep up with the growing cost of caring for an ageing population with increasingly complex healthcare needs, and when NHS staff are feeling stretched and under pressure. 70 years after its creation, the NHS continues to be highly valued by the public, with many seeing it as a national treasure. Looking at the bigger picture, change in the NHS is nothing new, and this is just a snapshot of where we are now. The story will inevitably continue.
So I couldn't have explained it better than that, and we often use that video in training. It's used at universities across the country as well, and I'm very pleased to sort of let you see it as my best reference and recommendation as to how we've arrived at the point that we're at. So if we sort of focus on Dorset and the organisations that make up they use the term accountable care system, but we're going to go with the term integrated care system in Dorset in July when we bring everyone together. We've been operating in a vanguard way in that area, in this area for around about 3 to 4 years. It is as it is anyway. We were a pilot Vanguard ICS area, so we've been having a system leadership team that's worked to some of the principles that are included within the vision. So going forward, I just sort of wanted to highlight the main members really. So adult social care, children's social care at Bournemouth and Dorset councils, they are key members. So we have accountable representatives from those organisations at the highest level. And of course, as we go down through the way that we run care day to day, we've got many representatives from within those social care authorities who represent. And a good example is that every day at the moment we have an operational delivery group which looks at the flow and discharge rates and has very much links in with senior management from adult social care systems to create the beds and the placements availability to be able to manage the back door of our hospitals, which creates flow and obviously enables people to be discharged eventually. There are a lot of people who are medically reasonably ready to be discharged in hospital in Dorset at the moment, and it's just finding the right amount of capacity within the care system to manage and bring those people home or into an appropriate setting. And that obviously comes with a huge amount of work to create that flow and a huge amount of resilience, and those care organisations that the councils work with are obviously susceptible to the main risks that we'd all experience as main NHS organisational providers as well. So there was a good description of what clinical commissioning groups are in the video. We're obviously overseeing standards. We're making sure that finances are allocated appropriately as per contracts being set. But in my position, I would work on gathering assurance from all the organisations that are still blacked out on this list here, the actual NHS providers. So assurance is a big word in the world of commissioning. It's effectively asking them if they meet core minimum standards and if there are any higher standards that should be aspired to as well. All those for these organisations are based on the Civil Contingencies Act. And if you've been part of this group throughout this week, I'm absolutely sure that Nigel and some of the team have confirmed what that legislation is, really the reason for emergency planning existing. So throughout the year, I'll sit down with these, the next 4 organisations, so Dorset County Hospital and Dorset University Hospitals NHS Foundation Trust. There are 2 acute trusts now, acute hospitals, as it were. UHD, the University Hospital Trust, has just merged Bournemouth and Poole, if you weren't aware of that one, the 2 big hospitals over in the conurbation. So yeah, we will sit down with both those organisations and ask them to submit lots of evidence that basically asks for assurance against the main pillars of the Civil Contingencies Act. So it's really straightforward. Anyone can understand. They have to have emergency plans in place. They have to have risk assessments in place. They must train and exercise as per their emergency plans. They're also, as category 1 responders, required to share information, warn and inform the public as required, be part of a wider exercise of media and communications. And of course, they have to have business continuity planning, which is the means of embedding service level resilience. So we go through all those and check that they're up to standard. And obviously, I've had to do that job myself for a council in the past as well. So it helps that I've got that background knowledge, as well as having all the guides and everything to checklist them against their performance. Another big partner in our area is Dorset Healthcare, University NHS Foundation Trust. So they're providing the community and mental health services to Dorset population. It's an enormous organisation, one of the biggest of its kind in the country. They're susceptible to all kinds of risks that hospitals aren't. So effectively, if you've got some really bad weather, their services are so mobile that they require access to 4x4 assistance, just like a social care company would. In a fuel crisis, they're a lot more at risk there. Those community services like district nursing teams, community physicists, community mental health provision, they're obviously very susceptible to having limited access to fuel. So we've been through a lot of articulating the amount of work that they put forward at any given day and what they need to do in advance to manage shortages with fuel and the like. So moving on, we have obviously got an ambulance trust. It's the largest in the country as per its square mile footprint, but South Western Ambulance Service, they have a huge amount of local resources. Again, the sort of pressure that they're under at the moment, I looked earlier on, and at the moment, I think there's between 350 and 400 people waiting in a queue for an ambulance call to be answered, or to be allocated to them, within the southwest of England. And that figure usually boils down to between 50 and 100 in Dorset on a bad day. So there's a huge amount of pressure there. Ambulances being affected by having to queue outside of hospitals at the moment to get admissions because there's not enough flow in emergency departments to admit enough people. So we have to work all the time throughout this pathway, be it from the back door of social care through to what's being done in the hospital to treat emergency cases, through to the ambulance trusts engaging with emergency departments and transferring and people being admitted. We're almost moving risk around all the time between those areas to try and create capacity and flow in the right place to keep everyone being seen at the right pace that they should be within targets. So it's really, really serious business. And obviously SWAST are a blue light provider, and there's we personally in Dorset, we do all their emergency planning assurance with them because we make sure that their contract's in place. We're sort of the lead commissioner on behalf of all the other parts of the Southwest. So I've done lots of resilience and assurance work with SWAST in the last few years, make sure they've got all their key plans, emergency plans in place for some of the chemical, biological, hazardous site preparedness that they have to have in place. So it's really interesting piece of work, and they're very, very well prepared organisation that obviously managed to work through situations like the Salisbury poisonings and situation, all the planning that went on for the G7 summit. SWAST were very central to that last year, and can imagine what sort of pressure that put on Cornwall's health system. Imagine if it had come here to Dorset as well. So primary care networks is something that I just thought I'd cover off as well. So primary care is that immediate intervention with your GP. And obviously your GP's boss still in terms of whatever happens within your healthcare. They can get you admitted into hospital at very short notice. So they kind of count within the urgent and emergency care network. It's not all about slow time services with them. So there was a quick reference to GPs grouping together in the King's Fund video. Well, that's happened in Dorset, and we've created networks. So I know it's a bit small to see, but I hope you can kind of focus in and maybe see where your GP practice is on this networking map. And you might be able to see just some examples. I was trying to say, Lynette, you're from Purbeck, aren't you? So we've got the Purbeck PCN in blue. They've got Beer Regis, Corfe Castle, Sanford, Swanage Medical Centre, Wareham Surgery, and Wellbeing Practice on there. So there's been a lot of work. You can see, well, I don't think Studland's got its own GP practice, has it? So
no. I think a lot of us go to Corfe Castle or Swanage, but Corfe Castle are wonderful.
Yeah, that's good going. So I'm glad to sort of show you this really, because it's part of the journey. It's part of this integration that we're trying to achieve, and bringing these services closer and grouping them has given them a bit more funding, and some of them have got joint offices that administrate on behalf of all those areas now. So they've streamlined quite a lot of work, and they have managed to bring additional services into areas, or share and cooperate. It's an important part of the long-term plan now that we've got for the NHS, is to work in this way at the primary care GP practice level. And they've been collaborating this way since July 2019. So it's really good just before the pandemic to get all this in place, because then we had to do the big push with them in terms of resilience for the coronavirus pandemic, which was keeping GP practices going but online. And we managed to persuade some very grumpy old GPs to go into online working at very short notice. So people who would never have used Teams or Skype or what the like are then suddenly running their clinics online. And I would say the stat we always come out with was about 5 years worth of development happened in 2 weeks to set them up to be able to continue providing those services. Real resilience and reactiveness. That's just one of the very good examples of what happened with the with the coronavirus in the first wave. So it's just a great way of using skills to across a greater range of professionals. And some of them are really quite small, as you can see, like the Lyme Bay one, or Jurassic, and they don't serve too many people. But I wanted to talk, give a bit more information about primary care networks, and there's another quick video here, so I'm just going to let this one play through.
Since the NHS started 70 years ago, the population has grown and we are living longer. Many of us are living with conditions like diabetes, heart disease, and asthma, or suffer with mental health issues. So getting help from our local health services is more important than ever. That's why many GP practices are working with each other and with community, mental health, social care, pharmacy, hospital, and voluntary services in local areas, covering around 30 to 50,000 patients. These are called primary care networks. Working together means they can have bigger teams of staff, including GPs, nurses, pharmacists, and mental health professionals. It means they can stay open for longer. And sharing staff can give patients better access to specialist health professionals and services like ultrasound closer to home. And they can share information and technology to offer better services for patients. Joshua is 10. He isn't normally unwell, but feels very ill one morning, and his mum is worried about him. She wants to see a health professional without needing to go to hospital, so she rings up her local GP practice. And although they are busy, they arrange an appointment at another nearby practice, where Joshua can be seen quickly by a clinical pharmacist, paramedic, or nurse practitioner. Many patients need help in this way, and for lots of patients with minor conditions, they can also get advice from the health professionals at their local pharmacy. Yasmin, 32, has type 1 diabetes and wants to manage this independently. Because of changes in the NHS, she can book appointments and repeat prescriptions online. She also checks her blood sugar levels at home and sends the information to the GP practice to monitor without needing to go in person. Yasmin can also have an online consultation with her practice or find out information to help her using a healthcare app. David, 81, has a number of complex conditions, including dementia and arthritis. Because his local health services share information, it means they all have his health records, so he doesn't need to keep explaining his story, and his health team know all about his history. The world has changed in the last 70 years, and our NHS is changing so that in our communities, patients can get access to the right care for their own needs.
So I hope that really sort of brings the point home, that the way we've got this designed and set up is ultimately resilient. Sorry, I'm just trying to I'll just leave that showing as it is there. I think it's efficient as much as it can be in challenging communities. I think if I've pitched this right, I've taken you on a journey down to this local level now, and those GP practices, they should be as core a part of a community as they always have been, even though they've got this practice partnership approach going on. We were written to as the storm warnings came out by a number of GP practices the other week saying, what do we do? Can we close early? We've got some concerns about local people. And my director on call at the time said, Liam, they know the communities better than anyone down there. We are in their hands as we go into this severe weather, that worst storm since the Sevenoaks and all the rest of it was getting the most horrendous forecasting, and we were really, really worried about that. So our advice to them was, almost like a school, you can make that decision locally in terms of what you can do to provide services going forward. And then we work with them all individually, as some of them are affected by loss of power, shortages of staff, to make decisions to open and close early, losing limited online capability, all parts of the county going on. But they really are core to community resilience. And I think anything that you do with your local level planning, don't be afraid to just link in with those practice managers that are within the local area. And we can always put you in contact with them through the CCG, and I will drop the primary care email address into the chat on this on our stream in this call in a moment, should you need to link in with anybody directly when you're writing your plans. And I think the way that we've got this set means that we can do resilience properly in terms of keeping services going. That's not only in terms of the storms, were there the impacts on them delivering what they had to, but we had so many customers without power, so many members of the public, that the GP practices worked with Dorset Healthcare, who've got the System 1 data, to go out and ratify who might be vulnerable in those locations. And we contributed to that piece of work, and the council even helped us map and plot that information, so that we could, as we got some of them within 7 days, had been impacted for that long, we could ensure that they'd had a visit from either from Dorset Healthcare or from a social care professional. So it really, for me, the big message was that the NHS does find a way, and it will find a way locally as well, and that primary care networks are now an integral part of community resilience. I think there's other good examples of how the NHS can be resilient at the local level. If you look at the vaccination campaign, that's probably the biggest humanitarian assistance effort this country's seen to deliver that since the war. The scale of it, the rate at which we had to prioritise vulnerable people, so much of that was done at GP practice level, and so much of it was facilitated by local volunteers. And I recognised so many familiar faces as I came and went from my own local practice, let alone the big centres that were all set up. There were local efforts that went towards making that place work, that whole process work. One other thing that we can see happening from a community response is around the bigger NHS providers like the hospitals. They've generated their own 4x4 response lists now, and their own processes for making sure the right people are safe to go out and transport staff when there's a shortage of when there's severe weather disrupting local traffic conditions. So I can see it happening. I hope it weaves in well with this week's work that you've been doing, this week's points that have been raised, yeah, I'm just happy to provide a bit of a flow about how things are going with us at the moment, how it all works, comes together. But I didn't have anything else to add, Nigel, actually.
Thanks very much, Liam. The NHS is a massive beast, and it's been under a lot of strain recently, hasn't it? So with, people are almost getting back to normal after, well, it feels like things are getting back to normal after that pandemic. Is there still evidence that coronavirus is still putting a strain on the NHS, especially in the hospitals?
Yeah, frustratingly, it's been plateaued at between about 75 and 100 admissions for coronavirus at the moment from about the last 4 months, and it just doesn't seem to be dropping right off. I think the national messages we're way off now, but it did actually go up by 20 people this week, which we were surprised to see. However, we're very much part of the national Living with COVID Safely strategy. And I think it's more where coronavirus has left us in terms of the delays of elective procedures that are just taking such a long time to recover from that. I think it's a 10-year journey really to get back to where things were before the pandemic, and they were strained then as